Hello everyone, my name is Maree, the Chairperson of the Australian and New Zealand Fontan Advisory Committee, and I'm here today with Professor Yves from the Fontan Registry and Mark Brooke, CEO of HeartKids. We've come together, the three of us today, to make a really exciting announcement that directly affects the Fontan community. Before we get into that part of things though, we're each going to speak about our particular organisations and how this has all led to today's announcement. So we'll let Yves kick things off by talking a bit about the Fontan Registry and the lead into ANZFAC.
So the Fontan Registry was created to mainly define the outcomes late after Fontan surgery and to build up a tool that would help to develop the research that was necessary to improve the life of people with a Fontan circulation. Very quickly after the beginning, the setup of the Fontan Registry, we had the advice by Fiona Stanley, actually, who told us you have to involve the parents and families into the initiatives, and that's how we invited first patients and families. After a few years of the registry collecting data, we had built a partnership project which brought us funding for the Fontan Registry for 5 years. And within that within that partnership, all the partners had to meet, and we felt that that would be the best occasions to have all the experts from Australia and New Zealand on the topic in the same place, and at the same time we could have a link with the families. Secretly, it was both ways, because actually having experts invited to talk to families kind of obliged them to come as well. So I was securing them coming for the day by having all the patients waiting for them as well. So that's I think that was working well both ways, but that's how we had the education there. And I was inspired to have somebody from the cystic fibrosis community talk to the Fontan, because I had made a lot of parallel between the community of cystic fibrosis and the community of the Fontan. And I will explain that. The cystic fibrosis history is very interesting. In the 60s, the median age of survival was 3 years of age with cystic fibrosis. So half of them were dying before 3 years of age. When I graduated at the end of the 80s, the people used to say to me that the maximum they could live was 25 years. And a few years later it was 45, and the last I checked, the median age was reaching, close to 35, it's even maybe more now. What happened in the meantime was no major breakthrough. The only thing that was done is better caring for the patient and tightening all the care of the patient with cystic fibrosis. So people were doing physio, they adopted a physio regimen, they adopted enzymes who were helping for the digestion, that were existing. No major breakthrough, using the same examination and the same antibiotics that the people were using before, but making it better in a more organized fashion. And all that was driven by patients' community. It all changed because in the 60s, the people with cystic fibrosis got together and they say to all the doctors, we want you to brainstorm and you look at all your results, because we know that in different parts of the country you're doing different things and people have different results. We want you to get together and come out with the best for our patients. And I think that's exactly what should happen with the Fontan community. By tightening their treatment, they can expect to have better outcomes. People do different types of treatments, different types of medications across the country. They follow them differently. If we gather together, we can define the best way of working. And the best way to get that done is by having patients' community together and putting pressures on the doctors, on the community, for having the things done for them the way it needs to be.
Thank you, Yves. So to follow on from what Yves has said, after the first, the inaugural Fontan Education Day in Melbourne in 2014, a couple of weeks after that, a group of people from within the Fontan community got together, including Yves, myself, staff from the Fontan Registry, and some other parents and adults with the Fontan. We had our first meeting and we talked about what we might do and what this might all be about to have a community voice. And over the coming months, we onboarded a bunch of new people as well and spread out a little more around Australia. Since then, we've expanded and we cover Australia and New Zealand. We have adults with a Fontan, parents of people with a Fontan. We've just got 2 new members, a young person who's under the age of 18 living with a Fontan and a young person just over the age of 18 living with a Fontan circulation. We have people from support organisations. We used to have a social worker from the Royal Children's Hospital, and we have people from HeartKids have been involved as well. From that point when we began, probably our first and most important task was finding out the needs of the Fontan community. So we developed 2 surveys supported by the Fontan Registry, and those were sent out to the community. It was the first time that we'd had the feedback directly from you about what your needs were, what your experiences were like, and that covered everything from medical experiences through to financial, your fears and your concerns around either living with a Fontan circulation or being a parent or carer of someone with a Fontan. From that point, that information that we got from you helped guide our conversations and decisions around projects, where we need to put our focus for advocacy, and just what's actually really going on out there and what we can do about it as a collective voice. We understand, and correct me if I'm wrong, but I think we're the only Fontan community voice internationally that's organised in the way that we are. So we understand the importance and the significance of having an organised community voice. As Yves said, the importance of having that and the ability to advocate is probably one of our key roles, but also to bring the community together so you don't feel isolated, so you don't feel like you are the only person having this experience. And so from there we started talking about what sort of projects can we do to give the community support and start to connect you all with each other, as well as where do we focus and prioritise for advocacy. So all along there's been overlap between the 3 organisations, the Fontan Registry, the community and HeartKids, including HeartKids New Zealand as well. So it's a very organic relationship anyway, because there's general concerns for the wider CHD community and then specific ones for Fontan. Over the last couple of years we've continued to develop projects and continue to work closely with the Fontan Registry. I know at the upcoming Fontan Education Day, Dr. Karen Duplessis will be talking about the results of the survey, so I don't need to go into that too much now, except to say that it is your feedback that has given us the information, has guided what it is that we're trying to do. We've spent the last couple of years, as we've developed projects, we have met some blocks in terms of, we don't have funding coming into ANZFAC, and just about how you put in all of the necessary protections, everything from insurance through to protocols and guidelines. So what that has led to is an offer that was made by HeartKids for us to become a subcommittee of their organisation, something that we think is probably a natural progression. We continue to have a fantastic and strong close relationship with the Fontan Registry, and in the future to collaborate together, just as we will with HeartKids New Zealand. And I think the most exciting part about this is the collaboration and that everybody feels really positively. I'll hand over to Mark and he can explain the role of HeartKids within the Fontan community, how they've worked with the Fontan Registry and with ANZFAC.
So first of all, thank you Rachel and Yves for the continuing support that you've given to the thousands of people that have had Fontan operation in this country. HeartKids is really delighted to be working with ANZFAC over the coming years, particularly because the Fontan community is such an important part of childhood heart disease in Australia. As long-term supporters of the registry and as long-term supporters of families and parents of children with a Fontan circulation, we're really delighted that ANZFAC is able to work in partnership with HeartKids as one of our subcommittees. We look forward to combining your expertise and our resources so that we're able to support even more families across Australia, and in partnership with our sister organisation in New Zealand, delivering services right across this country and throughout New Zealand. It is an important part of our community, the Fontan community, and we really do look forward to building on the outstanding work that's happened over recent years to enable all families to get access to important information, advocacy, support and research. HeartKids is really pleased to provide $100,000 a year for the next 3 years to support and continue the work of the Fontan Registry, and Yves and his steering committee are great contributors to our work, so we believe it's incredibly important that the HeartKids community rallies around this particular research project, because the registry is providing real-time evidence about what's effective and how we can contribute to the lives of children with a Fontan circulation.
Thanks, Mark. So ANZFAC spent quite a bit of time discussing the offer that HeartKids made us to become a subcommittee, and we're very excited today to announce that we have accepted that offer. What this means for the Fontan community is that a lot of the projects that we have been planning and hoping to do for the Fontan community can now gain the wings that they so desperately need and the support that's required to make them effective and give the most benefit to the Fontan community. We're really looking forward to our relationship growing with HeartKids, continuing our relationship with the Fontan Registry, and also maintaining and further developing our relationship with HeartKids New Zealand. What's probably the most exciting thing to tell the community about is that we're at a really fortunate point in history, if you like, at the moment, which is that all of these wonderful organisations are coming together and collaborating, which is going to have wonderful outcomes for all of you. And we couldn't be more excited about it and more grateful for the opportunity. And we're really looking forward to collaborating with each other. So we know you're most likely going to have quite a few questions about this new relationship and our relationship with the Fontan Registry, and also HeartKids New Zealand for our New Zealand community. So we'll be available to answer your questions online over the coming weeks, or if you'd like to reach out to us in person, we'll have some links attached to this video, so we'll let you know how you can get in touch. Thanks so much, everybody, and we're looking forward to the future.
Thanks, Rachel.